So the big problem with that is, and Frans Fanon spoke about this from a race perspective, right? So when things get repeated, we start to internalize it. And men have internalized this notion that they are not, emotionally proficient, that they do not engage. When I say emotions, I'm talking about a range of emotions, from joy and happiness right through to the worst of the worst kind of feelings, that one can experience. And so men have started to believe themselves, and they say it, we don't deal with feelings. And I'm like, okay, So I think because society has been quite relentless in often constructing men as bumbling fools.
Shahieda, thank you very much for coming and allowing me to have this very important conversation with you today. I think I'm excited about today's conversation, and I think many people, after listening to you, would have a different view about the subject matter that we're going to talk about today. So let's start at the beginning. Please tell us a little bit more about you.
Okay, so I'm a trained clinical psychologist. Currently, I am the acting regional director at UNISA Western Cape. Previously, I worked as the manager of student counselling at the University of the Western Cape. But I've now been with UNISA for the last 6 years, going strong. And and I think that the whole issue of working with men as a clinical psychologist actually took off at the University of the Western Cape. So I think that's what I think my PhD was also on men. The title of my PhD was the emotional experiences of participants of men's groups. So the whole focus of my PhD, and now also of the book, has actually been about my whole focus of psychotherapy has actually completely turned to boys and men. And so, yes, and I do see myself actually as a masculinity therapist. So that is a little bit about myself.
Right, so thank you, Shahieda, for that. And so today's conversation is going to be about men, but masculinity, but also the book that you are going to launch soon. But before we go into that particular discussion, you are a psychotherapist who specializes in masculinity. And as you said now, is you are interested in the mental health care for boys and men. So please tell us how you got to focus on that particular area. Why boys and men?
Yes, so that's very interesting. I was, when I took over as the manager of the counselling service at the University of the Western Cape at UWC, it was also an internship accredited site, meaning that master's level psychology interns will come spend a year with me. I train and I supervise them, and by the time they leave, they then are registered with the Health Professions Council. So I think taking on that job, here I came to the University of the Western Cape. It's got a very rich history and all that, but I thought to myself, but there's no group therapy at this very historical university in the Western Cape. And I actually introduced the culture and practice of group psychotherapy. And you must understand that in the curricula of trainee psychologists, there's very little group psychotherapy. And so psychologists in general does not really are not really located into understanding small group dynamics and how that brings about personal transformation. So I started this whole culture and training among the psychologists, the interns, and then one day I was actually I was marketing for the start of a new group. And when you market, you try and get people interested to join the group. And we were directing our marketing messages to both men and women. Then when it came the day for the start of this men's group, group, then there were only men there, okay? It was about 7 of them. And then me being who I am, I'm an early adopter. I go with, whatever's in front of me. And I facilitated the group as if a men's group is what we do, at that counseling center. And I must say, I then went to my group supervisor. It was Willem de Jager, is probably the most experienced group therapist. He's also a clinical psychologist. And he was supervising me at the time. And I said to Willem, what happened? I was starting a group and there were only men there, And I said to him, but I really enjoyed, working with them. I was trying to I thought to myself, I must now start doing things a little bit differently because there are only men there. But I didn't quite understand, But I just remembered my supervisor said to me, go for it, Shahieda. And since that time then, that was in 2009, and since that time I then started to adapt the therapy so that it is adjusted completely to the lens of a male audience. And by 2010, I shifted it also to my small private practice. And up till now, end of 2022, I have been running men's groups, father-son group therapy, couples therapy, because often the guy I'm seeing, then he will bring his partner. We do couples therapy, family therapy. So I think it actually started by accident.
So thank you very much for that. So this years of labor are now finally have another fruit that it's bearing, and that is a book that will be launched. And this particular book is titled, and I really love the title. The title is Masculinity Meets Humanity, an adapted model of masculinized psychotherapy. So let's start at the beginning. What is masculinity? And I think this is such an important question because sometimes people read this word and I don't think a lot of people out there really knows what masculinity is. So what is masculinity, Shahieda?
Yeah, so for me, before I even get to masculinity, I first understand that you are a person, right? And for me, I understand when I say person, Jacob, or whoever's in front of me, that person is not just an individual. Perhaps there's a clan, there's a whole culture, there's a whole tradition, right? There's an ancestry that is related to Jacob. So for me, a person is social. And so the way we then get socialized to be a man, the way a man gets socialized is he's following the scripts of where he comes from. So masculinity for me is a social thing. It's a social construct. It is constructed. It is derived. However, there are also biological, genetic components to being a man. And so for me, masculinity then is that combination of the genetic, of the biological, of the embodied, the cultural, the socio-spiritual. And so eventually that little boy starts to develop a sense and he starts to enact the scripts. And then of course he gets feedback from his from his environment about how he ought to be a man. And that process of masculinity is ongoing becoming. A man throughout his life is enacting a script in terms of who he is as a man. So that's my sense of what masculinity is.
That is brilliant, and I like it. The one thing that I think I miss is the feedback. The feedback that the boy is or that is getting to reenact. So and that leads me now to the next question: is masculinity bad?
Okay, so how do I approach this? Because I can get all philosophical and say what does bad mean, but I see so women, femininity goes through a similar process, because we are all, remember, both men and women are human beings, are people, okay? And so, but women then also starts off and they go through a similar process as men in terms of socialization in what it means to be feminine, right? But women also have an added biological dimension. Women's bodies, from the time a girl reaches puberty, right, she gets a far more deeper socialization in terms of her femininity from a purely biological perspective, okay? So I see men and women as two sides of the same coin, okay? Because they are both human and they're both responsive to the messages that society sends of them. So for me, a man and a woman, there's an equivalence, okay? So if you say a man is inherently bad, then it means a woman is also inherently bad. I think that a man and a woman, we've all got the duality of good impulses and bad impulses. And depending on where and how and the context, the woman will display more good versus more bad, and the man will display more good versus more bad, okay? But for me, both a man and a woman starts from a clean slate. So I'm not sure if I'm answering your question, but I don't see a man as bad or good. I see a person as a complex, layered being that comes with both impulses to be good and bad.
No, you answered my question. So because it's not to set up or say there's a right or wrong answer. It is to put masculinity in context, and I think the way you said is that there's two sides of the same coin, and in both in masculinity, or both men, both women, in femininity, you have good and bad impulses. And then it links to the first question or the second question, or when I ask you what is masculinity, is that it then depends on how the person is socialized and how many good or bad impulses is in the culture and the socialization of that specific person. So now this leads me to the next question, is what is the difference between masculinity and toxic masculinity? Is there something as toxic masculinity? Because that's one of the phrases that I and many other people are encountering online.
Okay, so can I be very honest with you, Jacob? I don't know what toxic masculinity means, all right? It seems to me as if ever a man does something, whether it's, bad, whether it's something Donald Trump does, at a particular point, or an ordinary man does something that is bad or negative, then that then gets construed as toxic masculinity. So I don't understand the concept. I don't know what it means. I've never seen a definition of it. Maybe I still need to be educated on that. And I don't think it's a useful concept either, okay? Because what started to happen is that toxicity and masculinity actually started to merge. And now manhood itself, masculinity, is seen as a bad thing. That for me should be extremely worrisome for any society. Okay, so if you ask me what is the difference between masculinity and toxic masculinity, I don't think there's a comparison there. I don't think it's useful to, I think it's important to be clear what it means, that masculinity is something, and then I don't think that toxic masculinity is useful to actually bring together with masculinity.
Thank you for that. So now that we talked about masculinity and kind of put it into context, we kind of have a roadmap, or let me say a base, to kind of enter a discussion on your book. So what motivated you to write the book? And the book's title is Masculinity Meets Humanity.
So what motivated me to write this book? I think it's related to what motivates me to work with men. Why is it that boys and men, and I'm talking about boys as young as age 14 years upwards, right? I've worked with all ages. Why is it that I now refer to men as my preferred therapeutic population? I guess because I can be quite skeptical. I do not believe everything that I hear, okay? And I think that's important. If you're a scientist and you want to remain close to the truth, you are a skeptic, okay? And also I always keep history in mind. Similar things that today are being said about men have been said about black people in general, across the world, all right? And so we must be very careful when we start hearing things like, for example, men don't deal with their feelings, okay? One of the things that I've experienced as a psychologist that runs men's groups, that does individual therapy with men, that does father-son consultations, I think that I find men quite easy to work with emotionally. When I set the stage, the psychotherapy, to be consistent with a male gender, so the minute you remove women, okay, from a group, that becomes a men's group. Why is that important that you remove women? Because the minute you remove women, several things happen. I'm talking about in the context of psychotherapy. Immediately, those men who are there are relieved from the socialized script of how they ought to behave in front of a woman. So they can then just focus on their personal development. Of course, also removing a woman removes the competition for female resources, okay? So men don't have to start putting up whatever, to impress women, whatever. But the most important thing for me as a psychologist, as a psychotherapist who works with men, is that when you remove women, all the tasks, the emotional task, becomes a male task. How to support each other, how to reflect each other's feelings, how to show empathy, how to ask questions that takes the person's grieving and processing of his feelings forward. All of that is done by men in a men's group. And so that is why, for me, men have become my personal favorite in terms of psychotherapy, in a total opposite of how the world perceives men when it comes to the emotions. The minute you make it safe, they trust me, they know that I'm sincere, I've been doing this for a long time, I'm a professional, then the trust is there, it's a safe place. Men deal with their sadness, they deal with very sensitive stories, they tell stories of pain, of loss, of rejection, of humiliation. So they start to deal with their feelings. And my approach is emotion-focused transformation. You cannot transform something, a feeling. Like, say, for example, you feel rejected or you feel upset, for whatever. you can't transform your state until you feel that feeling. So when you start, sinking into the feeling of desperation or rejection or loss or abandonment or whatever you're feeling, then you start to have different understandings, and that feeling shifts into something else, and so the behavior can change. So where a guy would then previously react with anger and react with aggression, because he's able to feel the sadness that underlies that aggression, or the unfairness, the injustice that happened to him, and it gets acknowledged, and he sees his pain reflected in the eyes of another man that is sitting there, it then allows a deep level of transformation to take place. So that's what I experience sitting so close with men, and their feelings. And so I don't see men not talking about their feelings because I can't get them to stop talking. That's my problem, okay? I don't see them not dealing with their feelings. They go into it because it's safe. They know that I don't report to their partners, They know that it doesn't go to the workplace. It doesn't go anywhere. It doesn't go to mom. It doesn't go to sisters, okay? What they share there remains there, right? And so it's free. So this thing where we expect men to, just like on cue, express their feelings. Why? I say to men, no. You don't just express your feelings because now society is saying that, you must show your feelings. No. You're a man, you need to think, is this a safe place? And once I've noticed, there's an agreement, this is a safe place, it's, I find men are very good at dealing with their feelings. Hence, I wrote an article, right? Men are emotionally competent.
Right, so in chapter 3 of the book, and it's to pick up now on that men do express their emotions. So I want to pick up on that specific part, and it seems as there's a misnomer, a belief that men do not want to better themselves or not deserving of mental health care. So in chapter 3 of the book, your major concern is the ontological and epistemological reconstruction of males as deserving recipients of effective mental health care. That's what your concern is from your experience. Do men feel they are deserving recipients of mental health care?
So the big problem with that is, and Frans Fanon spoke about this from a race perspective, right? So when things get repeated, we start to internalize it. And men have internalized this notion that they are not, emotionally proficient, that they do not engage. When I say emotions, I'm talking about a range of emotions, from joy and happiness right through to the worst of the worst kind of feelings, that one can experience. And so men have started to believe themselves, and they say it, we don't deal with feelings. And I'm like, okay, So I think because society has been quite relentless in often constructing men as bumbling fools, okay, that men are kind of, oxygen thieves. We no longer need men. We can just go to a sperm bank, okay? We don't even need, what do we need men for? And you get this kind of, which I think is extremely dangerous, and this, like in Afrikaans, is afbrekend, it is actually, that is for me toxic. The kind of messages that young men even are hearing, and they're internalizing them. So what I find is happening among men is that there's a high degree of self-hatred. Because men have internalized themselves and other people, and young women are taught, that men are just like, like we don't need men, So, so I think that, so what I had done in my own therapy, so I just want to quickly reference very practically what I do, and I call this a process of humanization, and a process first of affirmation and validation of who you are. So I have, that model that I developed, I call it the Afro-Eastern model of the self. It's a multi-dimensional understanding of the self, with having different dimensions, our intellect, our emotions, that is all integrated. But at the core of a relational self, because an African self is actually a relational, ethical self, is a self that is socio-spiritual. So at our core, our spirituality is a kind of spirituality that is actually continuous with the rest of the universe. That is when cultures talk about the divine principle of unification, of unity, right? And so when I start off therapy with men, whether it's individual, whether it's a father and son, whether it's a group, we first enter that space of, who are you? Ungubani, who are you? Wise kind is jy? Alright? Before we ask, what is wrong with you? Because remember, as a psychologist, the way I've been trained is you make small talk to get to the presenting problem. What I have done is to actually delay just slightly, few minutes. Because remember, I'm a psychologist. You are there for the problem, so I must keep the therapeutic frame. When you come to me, it's because we need to sort things out, okay? This is not, this is not a friendship, right? So, but what I do is just a few minutes, we just first introduce an understanding that is for most people culturally familiar. Whether you're coming from a Jewish, from a Christian background, from a Hindu background, whether you are atheist or agnostic, people can relate to the fact that at the core is an energetic force, right? And that's what we first go to. So that's what I mean is that with men, you first have to humanize, and I can see just that process of introducing them to an understanding of their transcendental, and dynamic nature. You can see even therapy happening at that level. So by the time we start talking about the problem, they have already shifted in their self-understanding.
So I know this is not part of the questions, but I think it's so important to ask because what you're saying is that masculinity meets humanity.
Yeah.
And what you're arguing is that before you start with the presenting problems and everything, you need to humanize the person, because let's say it's a gangster, or it's it's one of the boys that is taken in a war-torn country and it become a child soldier. So it's through that humanizing, you're arguing it's through that humanizing that it sets the stage for a psychotherapeutic intervention.
Yeah. So that because we also, you see, therapy often, define emotions as happening somewhere internal to ourselves. We know how psychologists are being criticized by other disciplines. Feminists, for instance, have a field day with psychology and criticize this whole notion, of this exclusively internal experience of emotions. We know that emotions is an emotional geography, all right? And that, for me, actually affirms the fact that the social spiritual nature is continuous. That is why we understand ourselves in an African, in a relational understanding of ourselves. We understand ourselves as separate, but we also understand ourselves as continuous with a clan, with a family, right? So what I also want to add to you here in terms of masculinity meets humanity. So there are several levels actually at which a man gets humanized in this model, in this Afro-Eastern model of therapy that I do with the men, is that so he first gets to engage himself as having a spirituality, as having a backbone, in other words, personal power, and all these dimensions, that is integrated with each other. But remember now, and this book is based on the men's group, the fellow participants, they engage with each other. So there's also a here and now process. We are humanized by the presence of human others. That is Ubuntu, okay? Is that we see ourselves as an extension of the other. And so the presence of the other men, looking at him with respect, with compassion, with understanding, is itself a humanization process. And so that is why the title of the book is Masculinity Meets Humanity. Because the purpose for me, ultimately, of any healing process is to humanize.
Developing this model of psychotherapy took you some time. It starts, stops, and a whole lot of experiences help you build this particular model. So, would you share some of your early experiences and mistakes, and how did that help you build sustainable all-male psychotherapy groups?
I'm not sure if I'm actually going to answer this question, because I think that, what I needed to do, to build this model was to go as close to men as I could and be as close to who they are, what they mean, So it really needed me to be, what do you call this in anthropology? You have to immerse yourself. Yes, you have to immerse yourself, because it's a different culture, okay? And so the one thing that if you enter a different culture, and I'm always aware, that men are a different culture to me, and then I bring that respect, and I listen, and I allow myself to be guided. So the one thing that I did from the start, I developed an evaluation form. And that form is also, it's in the book, And I literally, from the beginning, I would allow men to tell me what they liked, what they didn't like, okay? And what worked for them. And also sometimes they would just send me an email, not just in the evaluation form. And verbally, So I'm sure I made lots of mistakes. I'm not aware. I think therapy clients are very forgiving, just like children with parents. I think parents make lots of mistakes when they're raising children, but children are very forgiving. The most important is that you must be sincere. You must be honest, And I think men are actually very good at detecting insincerity. That is why, even as a therapist, you shift. You can't be this like formal, I'm a psychologist. With men, you have to be you have to go beyond just your persona. They want to know who you are, as a therapist. And so, of course, you maintain boundaries. I'm very boundaried. I don't go for coffee with my clients, okay? But there is a way in which I am present, which is far more, which is a bit different to just being a professional. I laugh, I get sad with them, within limits, But it does, I think, you get challenged if you work with men, and so that's where I began to appreciate that men are actually hulle speel dom when it comes to emotions. Sorry, I had to. I mean, and I think more and more I began to realize, that I guess also, being married, with being so close in a marital space with my husband also taught me, they may not always say things, but they are extremely sensitive and observant, about human relations, And so I think you need to listen, you need to respect. And the other thing that I want to add is you must know things, you must read, okay? And so you must understand men from all kinds of perspectives, all right? You must understand socioeconomics. You must understand the importance of work. You must know that work, even though women have entered, the workspace in droves, I noticed that the way men relate to work, it is something different. Okay? So you need to know things. You need to constantly learn. All right? So I think once I did make a mistake, It was at the time when I remember saying to my PhD supervisor, Professor Kupano Ratele, I used to have this conversation. That time I used to say to him, I used to feel quite insecure being a woman because I don't have peers who are doing this. I was always alone, all right? And I used to say, like, why am I doing this, and feel quite insecure. So there was a time when I started to just wanted to get men in, male therapists and male facilitators of the men's groups. And there was once when I actually got a bad male and he wasn't good for the men's group, So I learned that you must be very careful understanding the notion of the gender of the leadership when you work with men. Generally speaking, the knowledge and skills working with men is far more important than the gender of the facilitator. Okay? However, and this is often, how I had to explain myself. There's a chapter in the book just on the woman being a female with men, And this is often what is the most fascinating for people, but you're a woman, working with men. It is what I used to grapple with myself, and this is where I made my biggest mistake. So, it is more important that the person is skilled and that the person have dealt with their own shadows. Okay? Because this is what people don't understand. When I used to interview an intern, to come into the internship, I wanted to know, I said, I don't need the details, but I want to know, I see your CV is fabulous, but I want to know, what personal work have you done? Because you cannot engage the shadows of other people if you have not slayed some of your own demons. You can't, okay? So, and more especially when you're working with men, because men are, and I'm generalizing, because men are so diverse, okay? Not even two brothers are the same, but generally, I find that men are far more challenging, wanting to check you out as a person, okay? And so you gotta have a special confidence to be able to do that power bonding, I call it, with men. Because they were like, but who are you? Okay? And so the mistake that I made was to bring in a wrong man into the men's group. All right? So yes, even now I'm trying to train other men. I think first prize in a men's group is to have a male group facilitator, because a man directly affirms the masculinity of another man. Okay? And so you want to have the big man in the men's group, running that men's group. Okay? And so the literature recommends that there must be a male-female pair in a men's group. Okay? But remember now, so how do I think it's important now that I reflect on, so what do I do as a woman? So I indirectly affirm masculinity, and I authorize masculinity indirectly by getting men to validate each other. So the most important source of healing in a men's group are the men's group participants, not the facilitator. So the facilitator, you come from the margins, and you only centralize yourself when you have to do something. Bring in the quiet guy, sort out. You can see, these guys are going to start taking each other on. Maybe things can get a bit physical here. So you need to, keep the peace, make sure things, but that's your job. You're a techie. You're a technician, The people who heal each other in a men's group are the men, okay, not you. So that is why I'm saying you must have knowledge, You must constantly read up. You must understand the nuances of gender. And so, yes, a woman can facilitate a men's group, but you must understand the risk of being a woman. And you must understand how you must not be overwhelmingly present in the men's group, and how the way you the way you manage and present yourself in that men's group is not to detract from what is most important. So it's a minefield, okay? I make it sound so simple because, I've done it now for a total of 13 years, this year, and I'm constantly reading. And I think also writing the book was literally, it was really about putting out there what I'm doing, I'm going to pause there.
So, I've learned so much from just this interview, and I think I already have a lesson from this particular interview, and it's something to do with my grandfather. When my grandmother passed away, so my grandmother passed away before my grandfather. He became a completely different man, and for years I couldn't understand it. But today you said is that when you take women out of a men's group, and it's just the men, then the script is gone.
Different. Can I just need to add there, because I think I didn't even add the most important thing. You see, when it comes to the differences, now remember, little infant boys and girls are very similar when we're born. Boys are as loving, as little girls when they're infants. We love them, and that's why, people mustn't forget, that every man was birthed by a woman, and every man was once a little boy, loving, relational, wants to be hugged, wants to be affirmed. All of us, men and women, And one of my favorite authors, she talks about, she's a neuroscientist, she talks about the gender similarities hypothesis, and she talks about the fact that how both men and women are similar in skills, in aptitude, in intelligence, but it's also important to understand the differences between men and women, a combination, again, of environment, genetics, biology, and the social and so on. So here's where I think the difference between men and women becomes quite stark. It's in the way they relate to emotions. So when you take women out of a men's group, men can then, because women, when they deal with feelings, women go into feelings quick and they go deep into the feelings and they deal with the feelings. And men has a different way of dealing with their feelings, okay? You must first put the engine there in the room, and they'll poke at the engine, and then they'll take some more time. But once they get there, they are full on into their feelings. So when you remove a woman, men get the opportunity to engage with the feelings on their terms, because women because I also run women groups. And I also love working with the women. It's different, to working with the all-male group. But when you remove women, for me as a psychologist, right, is that men then can deal. Because they also, when they describe their feelings, they'll use like the satellite and male, symbols and male iconic things to explain their feelings, and what they also do, is that we'll deal with something very sad and very sensitive, and then somebody might crack a joke, and that I learned. It's okay. That's how men do it, And a woman will think, God, these guys are not serious, but we're dealing with sensitive issues. But yeah, I think I'll stop.
Yeah, so that will bring me to the next question. Second last question is, what have you learned, or what's the biggest lesson you learned regarding masculinity from your therapy session with men?
I think for me, what I'm so aware of in all this work that I'm doing with men is how we all need masculinity. There is something for me, that men bring that is unique, as you can see, I like masculinity. I think the masculine is really important. I think the world is so much poorer because fathers, even when they play with children, they do it differently. Fathers, when they look after children, they do it differently. There is a difference that men bring, that children want, that little boys, when I watch them wrestling with their dads, that I, as the most clever, the most whatever woman, I cannot do. So I think that what I've learned from all this work that I'm doing is that the world needs masculinity.
And this brings me to my final question, Shahieda. What do you think is the biggest problem boys and men face today, and what can we do about it? And when I say we, society,
I really think it's father hunger. Do you know that they can now measure? There are scientists who specialize they've developed an instrument to measure father hunger. What they find is that they find high rates of father hunger in both boys and girls. Because remember, that's a different conversation, but I can easily entertain you on what fathers do for girls, women, central. And that is why if we're going to want to make a dent, I don't care how we feel about men, and I understand the personal experiences women have had with men, that is toxic, that is terrible, that has been very abusive, and I have empathy with that and I understand that. But we are not going to make a dent in our gender-based violence rates until we bring men on board. And until we understand the knock-on gender effect, that men and women, men are not from Mars and women are not from Venus, okay? They integrate and they want each other and they integrate with each other. And so I often joke with women and I say, I'm fixing them for you, right? Because I see that when a man becomes, as he heals and he becomes better, he becomes more available to his child, to his children, and to his partner, And so if you're going to give me a lot of money and I have a choice whether I'm going to spend it on girls or whether I'm going to spend it on boys, and don't get me wrong, okay? I think we need to invest in girls and women, all right? So this is not about taking away the funding of the NGOs for women and girls. However, if you give me money, I will spend all that money on improving the wellness of boys and men. You know why? Because men are externalizers. When they are in distress, they're not going to say, I'm depressed. They're going to find something to smash, because that is the way they express their distress. I'm not saying that's right. I'm just talking in terms of the reality. And so as society, we must understand why for hundreds of years on this continent, we had manhood initiation. You gotta create spaces where men can get scripts about how to be men. Otherwise, we're gonna be mopping up blood like we do in this country all the time. So that's my take, that we need men and we need to heal men, because when we heal men, society, children, everybody benefits from male well-being.
Shahieda, thank you very much. Next time we'll have a conversation about father hunger and about parenthood and about parenting. I think it's an important conversation. I don't see a lot of blogs and things that are speaking to psychotherapists or qualified people when it comes to parenting advice. It's mostly people online that doesn't have the nuanced understanding and the kind of psychological training when it comes to parenting. And I think that's a conversation for another day. So Shahieda, thank you very much. This was beautiful. I enjoyed it, and I think many people online will enjoy it too.
Thank you, Jacob.